bigger than me being an artist, but it's something that I also connect to.
How excited are you walking down here, see all these people,
Yeah.
watching,
Yeah.
at the same time participating in basketball, and you yourself playing in the game?
Yeah, absolutely. This is what we need. We need to develop basketball in the Gambia because football dominates the sports scene in the Gambia. But I believe there should at least be a balance to the extent where Gambia can compete in the international tournaments, have a Gambian playing in the National Basketball Association, which is the NBA. We need that. We need to actually develop basketball and put more effort into it, because basketball is it's among the highest paying sports in the world. We know that, and it's something that can actually develop Gambia as itself. It can expose Gambia. So I believe that we need to work hard to develop basketball.
For Basketball Association members, this is a moment to put in plans for the future development of the game in the Gambia.
Thank you very much. Like I said, every year the basketball is coming back and it's growing. And first of all, I really want to thank everybody for coming. And if you look at the turnout today, almost 80% of them are youth. And this is what we're trying to get, the youth to come back to play basketball. I'm excited. And basketball is here to stay again. And I just want to encourage everybody to support basketball. And we still need assistance in the sense of infrastructure. And I want to thank the embassy for providing us the opportunity for us to be able to play this game here. The infrastructure is beautiful. And we're just excited. I'm lost for words.
The tournament, which began last year, has the support of the U.S. Embassy in Banjul and also saw a number of Peace Corps volunteers helping improving the skills of basketball coaches and players through periodic clinics.
I wasn't here last year for this. I missed it. And I am very excited to be here for the second tournament that we're sponsoring, along with the Gambia Basketball Association, with our Peace Corps volunteers. The atmosphere down here is just fantastic.
Do you see a future for the game in this country?
Oh, absolutely. With the number of people that are here in the Gambia, the ease it is to play basketball. All you need is a hoop, you need a ball, you need some people to get together. There is clearly energy here, especially with the young people.
It was a fun-filled atmosphere for the players and the many spectators who filled the stands of the old lawn, a significant message that explains the rise of basketball in the Gambia. For Grts Sport, this is Babukar Senghor.
And before we end this edition of the news, a quick look at our day's top stories. President Jammeh has joined the fellow regional leaders for a meeting with Japanese Prime Minister Shinzo Abe in the Ivorian capital Abidjan. Delegates from the ECOWAS sub-region have converged in Banjul for the 26th ordinary meeting of the West African Economic Monetary Agency's Technical Committee and the end-of-year statutory gathering. Central African Republic's interim president, Michel Djotodia, has resigned from office, leaving behind him a country teetering on the brink of all-out sectarian conflict. And Israel is mourning the death of one of the last remaining founding fathers of the Jewish state, Ariel Sharon, who died Saturday aged 85 after spending nearly 8 years in coma. Well, that was all in this edition of the news. Thanks for your time, and inshallah, we'll see you again at 2200 hours with more news. Until then, I am Fatih Janimay.
Sightsaver's vision is a world where nobody is blind from available courses and where people who are visually impaired participate equally in society. Its mission is to eliminate avoidable blindness and promote equality of opportunity for disabled people. The partnership between Sightsavers and the Gambia's Ministry of Health and Social Welfare dates back 30 years ago. The first formal program cooperation started in 1986 with the setting up of the National Eye Health Program in response to the eye care needs of the population. A blindness prevalence survey revealed a blindness level of 0.7% of the population. Cataracts accounted for 47%, trachoma 17%, and other corneal opacities a further 11%. Between 1986 and 1997, Sightsavers has supported successive eye care program cycles which helped bring down the overall blindness prevalence to 0.4% and pushed trachoma to a point of elimination. In 1999, the Ministers of Health of Senegal, the Gambia, Guinea-Bissau and Guinea decided to work together under a Health for Peace initiative HFPI that covered 4 main intervention areas. In 2001, the Gambian Minister of Health proposed the inclusion of blindness prevention as a 5th component of the Health for Peace initiative. This was subsequently adopted in August 2001 by the 4 health ministers at a meeting held in Banjul under the Banjul Declaration. Sightsavers mobilized funding for the development and implementation of the HFPI project to the tune of $1.5 million. The Zayed bin Sultan Al Nahyan Foundation of the United Arab Emirates contributed $1 million for the construction cost of the first phase of the Regional Eye Care Center, which included a clinic, administrative and training blocks, as well as a theater and public wards. The center, named after Sheikh Zayed, was officially launched in February 2007 by Her Excellency the Vice President of the Gambia and entrusted to a Gambian interim management pending the development and adoption of a protocol that would define the management of the center, including the roles and responsibilities of the individual HFPI member countries. The post-HFPI project is a 5-year eye health project from January 2009 to December 2013. It is funded by Sightsavers and the European Commission and is being implemented in the Gambia, Senegal and Guinea-Bissau. The goal of the project is to reduce poverty in the 3 intervention countries through improved eye health services. In the Gambia, the project covers the whole country, whilst in Guinea-Bissau, the regions of Wayo, Farim, Bafata and Kachu are covered.
In the Gambia, we already had some projects ongoing before the project started. So we are pretty much building on what was done here by the first HFPI project. But in Guinea-Bissau, we are in regions where there was nothing. So we went into Guinea-Bissau and built in new facilities and also trained eye health workers to cater for the population that were unserved. In Senegal, we are also operating in 4 regions.
The project is being implemented in partnership with the Ministries of Health of the Gambia, Senegal and Guinea-Bissau. Sightsavers works through the national eye health programs of these countries to implement the project. The Helen Keller International, which is based in Dakar, Senegal, coordinates the vitamin A supplementation with support from the nutrition agencies or units of the participating countries.
When the project started in 2009, our first region in Guinea-Bissau was Farim. In Farim, we started by building an eye unit in Farim Regional Hospital itself. And we also identified and trained eye health workers. We identified an ophthalmologist and also identified an ophthalmic nurse who came to the Gambia. The ophthalmic nurse came to the Regional Ophthalmic Training Program here in the Gambia for training. That was pretty much what we did. Other activities in Farim in that area were definitely like things like camps, cataract camps, sensitization of the population. And in the second year of the project, we went into the region of Bafata. And in the region of Bafata, we constructed a new eye unit in a settlement called